Support for the Health Channel podcast comes from Florida Cancer Specialists. Florida Cancer Specialists urges everyone not to postpone recommended screenings such as mammograms, colonoscopies, or biopsies. Regular screenings save lives. More at flcancer.com/getscreened.
Welcome to the Health Channel, all health, all the time. I am Cynthia Demos. The field of cancer treatment is continuously evolving, and therapies are getting better at getting rid of tumors while reducing side effects. One type of treatment that we'll be discussing today is proton therapy. Joining us right now, right here, is Dr. Matthew Hall, radiation oncologist with Miami Cancer Institute. Welcome, doctor.
Good morning, Cynthia. It's great to be here.
Thank you so much for joining us today. It's revolutionary what's happening in this field right now, so we're excited to talk about it. Before we get into our discussion, though, about proton therapy, can you tell us a little bit about the field of radiation oncology and the role that it plays in cancer patients' treatment?
Radiation therapy is one of three foundation stones of cancer therapy. On the one hand, we have surgery where we remove the tumor completely so that it doesn't come back. We have chemotherapy or increasingly targeted and systemic therapies that go throughout the entire body to eliminate microscopic residual disease or in patients who have metastatic disease at diagnosis. Radiation therapy is the third feature, and this is a local treatment similar to surgery, but it has the ability to help prevent cancers from coming back or help patients who are experiencing symptoms because of cancer spread.
So what led you to working in radiation oncology?
When I was in training, I really loved interacting with patients, but I felt that through many of my experiences, I would oftentimes find that you were always running from room to room and you never had a chance to meet with patients. In the cancer field, particularly in radiation oncology, I felt that I had more than enough time to really get to know my patients and that I wasn't incentivized to move more quickly and not have a chance to actually sit down, understand what patients were experiencing, and figure out the best way to help them.
And how has radiation therapy evolved over the years? I know this is it's a big answer.
So in many years ago, radiation therapy could be imagined as broad fields of radiation. So basically shine a spotlight on a tumor, and you would obviously hit the tumor, but you would also hit a great amount of normal tissues. Over time, and particularly within the last 15 years, radiation therapy has become increasingly more conformal. And so we have a greater ability to shrink the radiation fields down to more precisely target the tumor. And that means that we both have a better ability to control tumors, but also a significantly improved ability to reduce the side effects of treatment.
So when you actually do this, if the tumor's in one place, is there some kind of like protective guard around the other section, or it's that exact that you don't even need some kind of blockage?
All of the blocking typically occurs on the front end. So the machines are created in such a way that we can deliver radiation with pinpoint precision. When it comes to proton therapy, we have sub-millimeter precision with the delivery of the beam, and that the machine itself is actively shaping that beam so that it is protecting tissues on the sides, behind, and in front of the tumor.
Okay, so you touched on that. We are using something called proton therapy. This is a type of radiation therapy?
Yes, it is. It's the most advanced form of radiation therapy that's available to date. And it is a different type of radiation therapy in that it is more precisely delivered to tumors. So the radiation treatment, it targets tumors, and with pencil beam scanning, it's basically like a 3D printer. Layer by layer, the tumor has pinpoint proton therapy delivered to the target, and every day, the radiation damages the tumor so that it can't continue to grow.
It can do tumors as small as what?
We can do tumors as small as a fraction of a centimeter. But many of our tumors can be larger. The proton therapy is a very unique system in that it can treat tumors of large and small sizes in difficult locations.
So how does proton therapy differ from other types of radiation therapy?
So conventional radiation therapy behaves like a beam of light. And so you target the tumor, you direct the radiation right at the tumor, and it hits the target. but there's also exit radiation. And so all of the tissues that are beyond the target, normal tissues, they can have side effects, and that's one of the downsides of radiation. Proton therapy behaves differently. It has mass and it has charge. So it goes a certain distance, it deposits its radiation dose, and then there's no exit radiation. So it significantly reduces the exposure of the body to radiation therapy by about 50 to 60%, and this results in a direct decrease in normal tissue toxicity by about the same amount.
So what are the side effects then with this new, more exact kind of pinpoint procedure?
The side effects of radiation therapy remain about the same.
Okay.
However, the experience of patients, their quality of life, the number and severity of their symptoms is significantly decreased. So some patients who are treated for brain tumors, they may have nausea, vomiting, but this is significantly reduced by proton therapy. There can also be hair loss. We have found that this is significantly reduced by proton therapy as well.
Okay, fascinating and great to see all the advancements here. Now, okay, doctor, walk us through what a patient would experience during a typical proton therapy treatment.
So every time that patients come for radiation treatment, they will walk into the room and they will lie down on the treatment couch, which is then positioned in the room to precisely align the tumor in the path of the proton beam. For certain types of tumors, we have different types of immobilization devices, but the patient's job is very simple, just to lie down comfortably on the table very still. With proton therapy, we typically will have treatments that last anywhere from 30 to 40 minutes. The radiation is only on for a few moments of this treatment, but the precise positioning and the imaging that's required to deliver the radiation with pinpoint precision makes the treatment this long.
And how long does it take, though? I guess it varies depending on the size of the tumor, or can you stay in there only a certain amount of time? How does it work?
Some of our more complex treatments can last up to about an hour. Some of our most simple treatments, or most simple to position, can last as short as 15 minutes. However, it's highly site-specific, and it has to do somewhat with the degree of complexity of the plan.
And you always lay on your back?
Some patients can actually lay on the front, and this is a very good way to do it if we are trying to eliminate radiation dose to the anterior abdominal organs.
And then how many treatments does a patient typically need?
The standard form of radiation therapy oftentimes takes several weeks of radiation treatment, up to about 6 to 7 weeks of radiation. But it's specific to the individual type of tumor. So some patients will come and they'll only need 5 treatments to be rid of their tumor.
And when you say weeks, you mean once a week?
Once daily, Monday through Friday.
Oh, daily.
No Saturdays, no Sundays.
Oh, wow. No Saturday, Sunday, you get the weekend off.
The weekend is off.
All right. And can you feel it as it's happening? Do you feel like a heat or anything like that?
No. So proton therapy is painless. You don't feel anything. The only thing that you feel is the chill of the room and maybe the firmness of the table beneath you.
All right, and tell us just about, I saw there was some contraption that kind of holds you in place there. So how important is it to have the patient remain still, and what's used to make that happen?
It's incredibly important. So while the proton therapy can be delivered with pinpoint precision, under a millimeter of accuracy, it's always easier to hit a target when it's not moving. So in patients who have head and neck cancers or brain tumors, we oftentimes will use a mask that goes over the patient's head, and it just reminds them not to move.
Okay, and as the oncologist in this setting, what do you do to prepare for the procedure?
When patients come in to visit us for our initial consultation where we discuss radiation treatment options, we always try to include a tour of the radiation department and a tour of the radiation machine. And this will help patients to see what is going to happen so that they can become prepared and ready for the procedure when their time is due.
Who would be a candidate for proton therapy? Is this mainly used for specific kinds of cancer, or how do you decide?
Proton therapy is FDA approved for all types of cancers. The tumors that we target with proton therapy are those that have a high chance of cure and are located very close to critical organs, such that proton therapy can significantly reduce the risk of radiation toxicity. So both acute side effects and late side effects of radiation, if they can be reduced, proton therapy may be your answer.
Okay, and let's talk about head and neck cancer. First of all, how common is head and neck cancer compared to other cancers?
Head and neck cancer is, it represents approximately 4% of all cancers that are diagnosed in the United States per year, or approximately 62,000 cases per year. In comparison, it is less common than the more common types like breast cancer or prostate cancer, where breast cancer will affect approximately 280,000 patients per year.
When would you use proton therapy over surgery for head and neck cancer?
Head and neck cancers are oftentimes in very difficult locations. In some locations, they're easier to remove surgically, or the outcomes are better surgically, like for oral cavity or tongue cancers. But in certain locations where it's more in the back, or it's very close to critical structures where a surgery would leave patients very, very disfigured or have permanent problems with their function, radiation therapy is an excellent alternative because it preserves the organs, and it oftentimes preserves the ability of patients to lead a normal life thereafter.
Proton therapy help treat pediatric cancers?
Yes, it does. In fact, pediatric cancers are one of the prime indications for proton therapy. And the reason is that normal tissues are developing and our children are still growing up until they reach adulthood. And as a result, the normal tissues are much more sensitive to the effects of radiation than when we get a little older.
And so besides pediatric tumors and head and neck cancer, what other types of cancers can be treated with proton therapy?
The common indications for proton therapy include breast cancer in order to protect the heart. We also do brain tumors and spine tumors. On the proton therapy side, prostate cancer is an incredibly common diagnosis. And then we also are increasingly treating tumors across the rest of the body. So lung cancers, liver tumors, pancreatic tumors, and increasingly GI organs.
Why wouldn't you just use this every time?
So some patients have a greater benefit from proton therapy. In point of fact, there have been studies that have demonstrated the number of patients within a population that may benefit from proton therapy in terms of normal sparing. And we estimate that about 20% of patients will have a significant benefit in terms of reducing their side effects or improving their cures as a consequence of radiation. So it is an equally efficacious form of radiation therapy for most patients, but in terms of deriving the benefit, in terms of reduced toxicities, only a fraction of patients, about 20% in the general population, will derive that benefit.
Okay, and how does the location of the tumor make a difference?
It is critical for making the determination of whether proton therapy is important or not. So patients who have tumors that are very, very near critical organs, and particularly those organs that are very, very sensitive to even low doses of radiation, these are the most common tumors that would benefit from proton therapy. A great example is breast cancer. So for breast cancer, especially left-sided breast cancer, the heart is right underneath. And we know that for every additional gray of radiation that is exposed to the heart, there is an increased risk of heart disease and early death as a consequence of cardiac injury. As a result, reducing radiation dose to the heart is of paramount importance when it comes to breast cancer. And this is why proton therapy is used in patients that can spare the heart in this manner.
So can you have proton therapy if you've had radiation therapy before?
Yes, so reirradiation is a very common reason why patients will come to our practice to receive radiation therapy with protons. Approximately 10% of the patients that we treat at Miami Cancer Institute are receiving reirradiation who have been radiated before. It is a very difficult treatment to conceive because radiation effects are cumulative. Risk of toxicity goes up with repeat radiation, but because proton therapy is gentler on patients and reduces these toxicities, it is a go-to form of radiation when it comes to this recurrent setting.
So big question, what is the success rate for proton therapy?
Proton therapy is equally efficacious when it comes to most tumors compared to regular radiation. However, the benefits of proton therapy come from reducing side effects, and this is where proton therapy in particular shines.
What does it mean to use a multidisciplinary approach, doctor?
In cancer care, there are many specialists, and as a result, it oftentimes means that many patients will require different specialists in order to treat their cancer. So our patients will need to see surgeons, medical oncologists, radiation oncologists, and then all of the other supportive medicine departments that can help to make their cancer therapy a success.
So does that mean they all kind of get together and discuss the case at one time, or how does it work?
It can include multidisciplinary clinics, and that's something that we do at MCI in many of our specialties. And we meet once or twice a week and see new patients or existing patients that could benefit from seeing all specialties at the same time. But it also extends far beyond that. Even on days when we're not in a multidisciplinary clinic, I find that with cell phones and email, I'm constantly getting updates and questions from my team members.
Sure.
And so even though we might not physically be present in the same clinic on that particular day, we can still work together to resolve any issues or help to make sure the patients are well taken care of.
It's ongoing. And in addition to that, the cancer team is big and it encompasses many different fields of medicine. So can you tell us a little bit about the scope of cancer treatment and why the team approach is so important?
In terms of taking care of patients, there is only so far that any one individual can get to in any given time. We depend on our supportive team, including our physician assistants, nurse practitioners, including our patient navigators who can help patients get from one place within the hospital, one clinic within the hospital, imaging within the hospital to another. And even when it comes to cancer therapy, we depend on social workers, we depend on dietitians that will help our patients access care and get the support that they need to make it through successfully.
Okay.
We can't underestimate the value of all of these team members in making sure that each patient's story is a success.
And what a great peace of mind for the patients to know that so many specialists are working on their case together, right? How many proton centers are there in the U.S., doctor?
There are currently 26 active proton therapy centers in the United States, with 4 more that are in development or due to be opening within the next several years.
So why is there less access to this type of treatment compared to other cancer therapies?
Historically, proton therapy is a much greater investment in terms of radiation technology, whereas conventional radiation technology may cost approximately $5 million per machine. Proton therapy has historically costed far more than that. Fortunately, the costs have gone down over time. However, you still average approximately $35 to $40 million per room for a proton therapy center.
Okay, does insurance cover proton therapy?
Yes, it does. So insurance does cover proton therapy. However, with all of the ins and outs of getting insurance approvals for covered therapies, there continues to be a significant impediment to access to care, which requires insurance authorizations, as with all other parts of healthcare.
And how often do you treat patients with proton therapy at Miami Cancer Institute?
In our radiation oncology department at MCI, we treat approximately 160 patients per day. About 30 to 35% are treated with proton therapy.
Oh, wow. 160 patients a day.
This is actually fairly unique. Many proton therapy centers are exclusively proton therapy centers, so all of their patients are treated with protons. Oh. At MCI, we have a comprehensive radiation oncology platform, including 7 conventional radiation therapy machines and 3 proton therapy gantries. So while our proton therapy unit is fairly busy, it's only a necessary, or it's a component of the comprehensive radiation therapy services we provide.
So you must have people come from all over the place for this.
Our primary focus at MCI is to deliver high-quality cancer care to the patients of South Florida. However, Miami is a locus where many patients from all over the world come for their cancer therapy, and so we have treated patients from as far away as the Caribbean, Central and South America, and even Asia that have come for the services that we provide at our center.
So how do we improve access to treatment that might be too expensive for some patients? It's expensive to come from Asia.
It is incredibly difficult to uproot a patient and move them to a different location to receive their cancer therapy. And oftentimes this can be detrimental to their care because they have been taken away from the primary medical team that knows them the best and has been instrumental in delivering their care up to this point. In terms of increasing access, I think that there are 2 focuses that we need to take. On the one hand, the easy solution is to increase the number of proton therapy centers so that more patients don't have to drive or fly long distances to get this therapy. But also, more importantly, we need to precisely determine which patients benefit from proton therapy so that if patients can be adequately treated with conventional radiation, then there's no reason for them to travel. We want to find the patients that have the greatest amount to gain from proton therapy, and that it is critical that they travel, even if it's those long distances, to take advantage of this important technology.
And are clinical trials a good option to get involved in, and what exactly are clinical trials?
Clinical trials are research studies that help us to answer important clinical questions. In the most exciting, we are testing some novel therapy, like some new anti-cancer drug that is going to significantly improve how patients are cared for a particular type of tumor. But it also helps us to answer other questions. And for proton therapy, one of the questions that we like to ask most is, what are the side effects of radiation therapy and how do they compare to conventional radiation treatment? We might not necessarily be as interested in improving cancer outcomes, but we are more interested in figuring out how we can better serve patients, how we can reduce their side effects and their quality and improve their quality of life as a consequence of radiation. So it is oftentimes a comparison or an effort to improve cancer therapy by asking the right clinical question.
Okay. So let's talk about clinical trials a little bit more. Do they help reduce the treatment costs for patients?
The overall goal of many clinical trials is to improve cancer therapy. And some of the questions that we are trying to answer now are to optimize cancer treatment. And as a result, sometimes it's not more therapy, but less. So in terms of determining how best to treat patients, if you can find the most optimal solution, that is going to drive down costs.
Okay, makes sense. Doctor, what does the future hold for proton therapy, and will it be offered to more types of cancer patients?
I think that proton therapy is going to become the next, or the last greatest advance in radiation oncology, and I think that we are currently experiencing the renaissance of directing this proton therapy to a wider variety of and types of cancers.
And what are some other cancers that could be treated using proton therapy?
Historically, proton therapy has been used on very simple tumors to treat, like prostate cancers, or patients who have really bad outcomes if we don't use better forms of radiation treatment, like pediatric brain tumors. But increasingly, we have been treating tumors all over the body, and some of the most exciting ones are those in the abdomen and the pelvis, in the GI tract.
So one type of cancer being studied is anal cancer. Are they trying to see if proton therapy could reduce side effects?
Yes, this is actually an area of interest at our department and also at other proton therapy centers across the United States.
And what kind of side effects do patients with conventional radiation therapy experience?
Anal cancer patients typically receive both chemotherapy and radiation therapy. And as a result, they are prone to significant abdominal discomfort with nausea, vomiting, and then also this painful form of proctitis, this injury to the rectum where it can be painful, burning discomfort to have bowel movements. Because of the chemotherapy, they also have reductions in their blood counts. And since they depend on chemotherapy in order to help get rid of the tumor, drops in blood counts can prevent them from having such a good outcome. With conventional radiation therapy, these side effects are very common. Since we started employing proton therapy, we have found that most patients have significant reductions in their nausea. They get through treatment without any of those horrible side effects that we've seen in the past. And their blood counts also seem to be preserved so that they get through treatment better.
Is this an ongoing trial?
This is part of an ongoing phase 2 trial that has been developed by my colleague at MCI to look at decreases in acute toxicity as a consequence of radiation therapy in this population.
Okay, so this brings us back to the importance of clinical trials. Not only does it benefit patients, but it helps progress research, yes?
Yes, so clinical trials are an important cornerstone to determining if we can improve cancer therapy and then validating that the technological advances that we have spent a great deal of money on, like proton therapy, actually lead to a significant clinical benefit for patients who are treated with it.
Can you tell us just a little bit more about this clinical trial called RADCOMP? RADCOMP, right?
Yes, that's correct. RADCOMP is a randomized trial that is comparing proton radiation versus conventional radiation therapy in women with breast cancer. The goal of the trial, the primary endpoint, is to determine the number of cardiac events that occur as a consequence of radiation therapy. The thought is that proton therapy significantly reduces dose to the heart compared to conventional radiation therapy, and that this will lead to a clinically significant reduction in late heart attacks and other cardiac morbidities in patients who are followed for years and years after the therapy. We know from existing literature, long-term survivors of breast cancer and Hodgkin lymphoma, that any dose of radiation therapy to the heart is toxic. The question is, how much benefit can we get from more advanced radiation technologies? And that is exactly what this trial is looking at.
Okay, so who would benefit from this clinical trial? What type of patients?
For this particular trial, we are looking specifically at breast cancer, but we believe that the benefit of proton therapy in terms of reducing dose to the heart will help any patient who has radiation exposure to the heart. And this is why we have such interest in tumors in the thoracic area to be treated with proton therapy. In addition to breast cancer, we also treat patients with primary lung tumors and lymphomas, where the tumors are so close to the heart that we can lead to a significant reduction in heart damage as a consequence of radiation.
Now, once a clinical trial's already started, you can't then enter it. So if someone calls in, oh, I would like to be part of that trial, that's not how it works, right?
So patients, when clinical trials open, they are then recruiting patients that will participate in the trial. RadComp is currently open, and so patients who are interested in participating or who are coming to participating centers with a diagnosis of breast cancer, if they are a candidate, they will be offered enrollment on this trial. And we support patients in making this decision because we will never know the true benefits of our advanced radiation modalities if we can't encourage patients to participate. So this is a great opportunity to both get cutting-edge radiation technology and then to also help future patients that could benefit from this technology once its success is proven.
Okay. So overall, how is the technology of proton therapy evolving?
It has made remarkable changes in even the short time that I've been in the radiation field. From broad beams of proton therapy using double passive scatter to this precision pencil beam scanning 3D printing technique of painting it right over the tumor and missing normal organs, proton therapy has gotten incredibly more facile in the time that we've been seeing it. However, we're also getting even more incredible. We now can employ onboard imaging to more precisely identify where tumors are located in the body and treat them with even greater precision. And we are developing new strategies to deliver the radiation in a very, very high-dose manner that will help us to potentially improve cure rates.
Wow. Okay, so to wrap up our discussion today, let's go ahead and go over some of the benefits of proton therapy. Doctor, let's go through these kind of one by one.
So the primary focus of proton therapy is to target tumors very, very precisely. And this helps us to both be certain that we are hitting it, but also to reduce the side effects to normal organs. The main benefit, the primary benefit that most patients will receive from proton therapy is reducing toxicity through reduction in side effects. So by reducing nausea, vomiting, hair loss, decreases in blood counts, mucositis in the throat, risk of heart disease, any number of these features, this is the primary benefit of proton therapy. Proton therapy has also been shown to improve quality of life in patients who receive it through reduction in these late side effects. And it's also used for difficult to treat tumors, like when the cancer has come back after a first course of surgery or radiation therapy.
Amazing where we've been, amazing where we are, amazing where we're going with this, right?
I think that the future is very promising for radiation therapy, and part of the way that we can do it is to make it far less costly on patients. Proton therapy is supposed to be harder on cancer, but easier on you.
Okay. Thank you so much for joining us. I am Cynthia Demos, and I will see you next time.